Yeah, lazy eye, medically it's called amblyopia. And that's when, if you really have lazy eye, it means that when you were young, there was not enough stimulation to your optic nerve for it to grow normally. So it's really an irreversible condition. Now there's some new research that shows that even at an older age, older than age 8, if you improve the vision in that eye, you can get some benefit, but it's a small percentage of cases and small percentage of benefit compared to how much you've lost. Now, lazy eye is different for every patient. It could be really bad lazy eye, amblyopia, or just a little bit. How do you prevent lazy eye? So if you have kids, you want to make sure their eyes are straight. If not one is crooked and looking, because that means that the eye could develop a lazy eye or already has developed a lazy eye. They should have an eye exam to make sure they don't have a cataract or some other condition in the eye, a cancer or something like that in the eye, because that could block the vision. Obviously, if it's a cancer, we want to treat it, right? But anything that's clouding the vision can cause that eye to become lazy and not develop properly. And finally, if there's a prescription in the eye, and especially hyperopia or farsightedness. If you have one eye that's nearsightedness, they still have stimulation because you can still see near. So you don't get lazy eye with nearsightedness usually, unless one is a lot worse than the other. But if they're farsighted, they're not focused on anything, and that eye becomes lazy, whereas the other eye, they just start using one of the eyes. So one of the classic tests is like if you have your kids, you cover one of their eyes and they start crying, that means they couldn't see out of this eye, and you cover the good eye. So that's one of the tests, but you want to try to see if they can see through both eyes. I always encourage patients to come in to figure out what's going on. Is it really lazy eye? Or is it really a cataract that's there that's not treated? We will do a thorough examination to determine if you really have lazy eye or not. Now, if you have lazy eye and it's not too bad, you could still have laser vision correction. If it's really bad, then we discourage that, because even though laser vision correction is extremely safe, I tell patients their lazy eye is not as good of a spare tire as someone that had perfect eyes. So if they have a little bit of lazy vision, usually around 2040, 2050, we feel like the risk benefit, depending on their occupation and what their needs are, it's worthwhile to do laser vision correction because the benefits outweigh the risk. And if you lose a little bit of vision in one eye, you still have the other eye.